Everyone. I am Mel from Tact Book. We are a nonprofit training provider that helps schools and healthcare systems to stay safe at their own operational tempo. So this is one of our key portions that we teach is called scene safety in healthcare because believe it or not, we really don't learn this as clinicians. And I think a lot of folks in the security industry assume this is something that we're just practical about thinking. We're not. The majority of the population is female. And, when you look at the genetic makeup and predisposition for females, they just generally sometimes don't have good situational awareness. So it is something that we have to curate. And even for our gentlemen as well, they think we're going to work. We really shouldn't have to think about our safety, but with the violence rates increasing in healthcare, we know that to be true. So the number one objective for this is really to minimize risk, right? We know that risk is inherent as a part of the job in healthcare, and we can't get rid of it. I think that there's a lot of push for saying, hey, we're going to do risk assessments, threat assessments, and get rid of this stuff. We can't. We are humans taking care of other humans who are an exacerbation of their human existence. So we really need to understand that the risk is always there. We just need to minimize it. And this also will enhance patient care. All of our training modules are designed to do that and reestablish trust. So the only thing needed for this, which I love to give to nurse managers and trained nurse managers and preceptors and charge nurses, you only need the patient room and the lecture guide that we provide and the staff to do it. So you'll see in your packet that came in your email, there's the scene safety just an outline that we use in our company. All of them are standard so that when you get the Tact book, it has everything in there, all collaborative with the QR codes that you can scan and be able to do the training yourself and implement those scenarios for the things that are digital or able to be used with the VR and the different capabilities that we have that are not our live sessions. For clinicians, we do have live sessions that are required for various reasons. But let's stay focused on our scene safety. So for today, we're going to be talking about the first thing is determine if a room is even safe to enter. A lot of people just don't understand the principles of that. And for all you security folks, that's something that you guys should be generally versed in trying to explain to clinical staff how to assess a room for threat and risk. And so those are things that we do help those clinical people that don't have any understanding. We do that on our Tact side. Number two would be to identify and categorize them by green, orange, and red. Mel, why don't you use a stoplight method? Why don't you use yellow? Well, lots of people run yellow lights, and especially nurses when we're late to work. So we wanted to enhance the idea that orange does not mean just blow through it and see what's going to happen next. And we also do have a yellow algorithm and color code for our badge reel things, so we don't want to confuse the two. And number three, you want to approach the patients tactfully while assessing for violence. So one of the key elements that we train is a tactful approach, and that's part of our training, and it's specific to clinical providers and clinicians and anybody that's really taking care of patients or interacting with patients at the bedside. So you can read through that. It's pretty self-explanatory, but I figured I would just provide this guide to go along with it. So again, here are your safe zones. When I teach this live or one of our tactical trainers goes out and teaches this live, a lot of times we will put tape on the floor if we're simulating in a room, or we can use sticky notes. I give the nurses a stack of sticky notes that are orange, red, and green, and then they place the sticky notes on the areas of the room where they would establish as their green, orange, and red zones based on the distancing techniques that we teach. And so this is just to give you an idea around the bed within reach of the patient, obviously a red zone, especially over there in that corner where you'd have a really hard time getting out. Anything with furniture that you have to sidestep or walk around is considered orange. And then anything with green, a direct shot out, assuming that you and I are at the door looking into this room. Again, here we go. I put this in here because Anytime that there's equipment around, we want to make sure that we understand that that's considered an orange zone. Now, this is a ventilator. This is a really old picture of a ventilator. I do encourage all security people and training people to have their security guys go into the ICU, learn what equipment is life saving, learn what equipment is essential, so that when you're in that scenario, you know that this is a piece of equipment that we just can't move around. Versus this one, we probably could without it causing a life saving, you know, problems. But there are times, especially in critical care, where these cannot be removed, either those IV poles. So those are conversations that we need to be having with the care team as we go along. But this is just to identify that obviously the ventilator would be attached to a person, so it's considered their red zone because it's in proximity. And anytime we're looking at this equipment, or you're turned your back to your patient to do the IV pump, we don't recommend that. I always recommend that you're facing the patient, or if there's people or family in the room and you would have to put your back to them, have them move so you can provide safe care when you're in the room. If they won't move, that's a pretty good behavioral anomaly indicator. And that segues into our 4 steps of this program. And so for this interactive activity, we're first identifying the zones. Again, I said, use that tape or sticky notes on the floor, and just drill over that in the different room layouts that you have. And then recognizing behavioral anomalies. Nurses do not know what a behavioral anomaly is. We are not taught that. Same with clinical staff, doctors, physical therapists, respiratory therapists, and simple things like eye rolling, refusing of care. Again, if you ask the family to move and they say, no, I'm not moving, that should automatically put you guys on an alert, okay? And I would consider that family member being as an orange, as something that we would be watching out for. And then the tactful approach. So this is basically how we approach folks in the zone, how we talk to people. And this is something that is really important, and it really isn't being taught at the bedside. Sure, we have AID-IT and some other things, but they don't talk about the why. And the why is to establish them as experts in their field, to develop that rapport quickly. It doesn't matter how many times you've been in the room that morning or that afternoon. Good morning, my name is Mel. Sorry to disturb you, Mr. Jones, but I need to draw your labs. I only recommend mentioning 3 tasks that you might do at a time, because it can overwhelm them. And especially if we get to the algorithm where you're showing those signs of behavioral anomalies, then we really want to back it off to 1 task at a time, and then provide that medical rationale so that they can understand why you're in the room and why that's important to them, because that's majority of the issues that we see is just because it's a miscommunication and they don't understand why the doctors ordered those things. And nurses are very busy, and culturally and with the demographic that we're in, we want to make sure that we provide as much education as possible in that beginning interaction. And then we use our counterbalancing techniques. So we do not use de-escalation. I don't believe in de-escalation. I think it places blame on the patient for having an emotional response, and then places blame on the caregiver for also having an emotional response to the system's issues and the difficult day that they're having. So we try to balance that. And the portion of counterbalancing that we're using here is the intuition and response. So first step, obviously, step back into the green zone, ensure that the door is open, or return behind the door if necessary. Using the door as a barrier is something that we do teach. And then reattempt care by breaking down that action item into smaller steps. Again, using 1 step at a time and helping that patient to get to that opportunity as quickly as possible. This is just our basic protocol. Again, you'll see that green zone, orange zone, red zone here on the right-hand corner. And then obviously we have an algorithm, and we break violence down into active and passive because nurses just don't have the time to absorb any more education than they need to. So we verify scene safety. If it's there, we go ahead and proceed. If at any time it becomes unavailable, the scene is not safe, we have to back out into a zone, we follow our TAC response protocol that's here. And that's all in our full training suite. Again, here's that tactful approach: greeting, introduce, acknowledge, your care action, your rationale, and you remain alert the whole time. Again, I put this in here because in healthcare, it's important to understand that security is not the absence of threat. We will never not have threats. We will never not have risk. but it is the presence of connection to our patients that's really going to save us and to the organization. A little bit about the demographic. So folks that aren't at the bedside or don't understand healthcare may not understand that the majority of our nurses have less than 2 years of experience. And per nursing theorists, that's not even a beginner nurse. That is a very novice nurse. They don't learn anything. I would say when I was a nurse, I didn't know anything that I was doing until I've been a nurse for like 2 to 3 years, really. And those nurses just don't exist at the bedside anymore. And so we have to understand where they're coming from. Young nurses today also struggle with, adult interactions. And because they're so absorbed into social media and the phone, and that's how they interact with each other, it's really difficult for them to have mature, rational conversations. So we need to be putting that as part of our training. This is just a little bit of data that we've recently collected. Again, it's significantly more than what you see at the Joint Commission surveys or what you're going to see from HIMSS or other areas like that. And that's because people aren't participating in those surveys. It comes in an email. No one checks their email. These were surveys that we did directly with patient or with our caregivers at the bedsides in the different facilities we've been in personally. And they will tell us the truth. Obviously, we're doing the training. It's coming out as we have conversations. They begin to trust us. We don't work for the organization. So we believe these numbers to be significantly more accurate than any other surveys that are out there. Again, this training was brought to you by the following in our team. The one thing that makes TACT unique is we are a nonprofit, and we are a global advisory board of almost 40 experts that come together to write these training protocols and the TACT book, to which we should probably be using as kind of a military doctrine or dogma in order for us to move forward. And so we have our lead trainer here, Mr. Dela Cruz, obviously myself, I'm just the bedside expert, Doug Melia, use of force expert, and then Dean Malpass is a behavioral health and mental health expert who helps us to identify those behavioral anomalies and helps nurses to rapidly assess things. So if you'd like more information on training programs that we offer or how you get involved with our nonprofit, TACT Book, we'd be happy to help in any way that we can. And please be sure to reach out and let us know how your training is doing. You can use hashtag Scene Safety TACT as you train your nurses, and we will see you guys soon. Thanks.